Dr. Qazi and myself, we've co-founded Minds, which is Medical Network Devoted Service, and that's one of our compassion is to give back to the community. Minds Medical Network Devoted Service basically is a network of physicians that we provide free medical health care to those who cannot afford it. We get our referrals from clergies, from nonprofit organizations, from other physicians, and we basically provide specialty care throughout the board. We try to find a physician as close as possible to the location of the patient who will treat them at no charge. And we'll take care of any other costs that they may have. We co-founded Minds approximately a year ago, and we've been very active, and we've seen a lot of patients. We even did a study recently and presented the study about the organization in Chicago, where they had a medical conference about religion and medicine. Quick short history, we find out about mental health that in Baghdad in the year of 705 CE, as now being politically correct putting it, which is our date AD, as we know it, is that it was the first psychiatric hospital that was built, and that was built by the Arab Muslims at that time. At that time, under Islam, the mentally ill were considered incapable, yet deserving of human treatments and protection. So we see that mental illness was actually recognized back over 700, 800 years ago, and people were looking into it, 500 years ago, I'm sorry. People accepted it, yet they looked at it in a different realm, which we'll discuss a little bit later on, and that the Muslim community was actually the first community in the history to recognize it and build a hospital for these people. In 1984, the World Health Assembly, when considering the global strategy of health for all, to be implemented in the year 2000, they stressed out on the importance of spiritual elements and in the health of the patient. Also, we find out that in 1961, a book that was called Modern Man in Search of Soul, which was written by Jing, he emphasized on the importance of religion in attaining psychological health and enjoying normal state of mental well-being. So, Islam. What is Islam? Islam comes from the word aslama. Aslama means somebody who submitted to God, to Allah. He complete submission. Allah is God. It's the Arabic word for God, and that word was actually and still used by the Jewish and the Christian-speaking Arabic, and it was revealed to in their books as well as Allah. Now, Islam dates more than 1400 years ago, yet knowledge about Islam, about the Muslim religion in this country is very little. It has picked up in the past few years, and people became more aware of it, yet it is, despite this increased interest right now, it is still, the average person knows very little about the Muslim religion or the Muslim patients and what they should be treated with. Numerous studies have found that there is a significant positive association between religion and spirituality for a better mental health, well-being, defined as having more hope, optimism, purpose, meaning in life, greater marital satisfaction and stability, higher level of social support. Also, religiosity has also been associated with less depression, anxiety, also lower suicide rates and lower substance abuse. Now, that's across the board. This is absolutely no difference when it came to the Muslim people. When the research was done, Muslim people found that those who practice religion are exactly in the same thing. They are found to be also religious and spiritual, and with the practice of their faith, they experience more happiness, more joy. Their life satisfaction is higher. They're more happier and content with their marriage. They are less likely to be depressed, less likely to suffer from anxiety or antisocial behavior, or any other issues such as suicide. Islam also provides comfort and meaning of identity, spirituality, and that it's been found that Muslim people go back to religion and emphasize on their religion when they are under stress or they are coping with an illness or any other stressful life events. Now, for a healthcare practitioner, the lack of knowledge about the Muslim community and about the basics of Muslim religion, practices, beliefs, can impose a significant hinder in the way of approaching and treating these patients. Because let's face it, our group, the Muslim patients, are already under scrutiny from problematic such as issues that are happening right now in this world. So for a clinical setting, this can reflect back on these patients from the practitioner in the sense of if they are not aware what is right, what is wrong, also some of the religious beliefs and some of the misconceptions that carries on that we are actually bombarded from the media these days about it. So if a practitioner does not understand these issues, he may not be able to go ahead and provide the best care and also build a bridge of communication between him and the patient. And we know that there's an increase in the strength of the therapeutic relationship between the clients and the practitioner by forming the foundation of trust. And that trust does emphasize on building the relationship by knowledge and basic understanding of what the faith is about, what the religion is about. Also understanding that Muslims do come from a variety of countries. So there is an ethnical background that may play a role from one country to another, and certain beliefs that are cultural, not religious, but a practitioner should be aware of all these things regardless of the religion or the ethnicity in order to provide a better treatment to the patients. Now, Muslims believe their mental illnesses can be attributed to spiritual disease or distancing from Allah, God. Okay? This does not mean that everyone who suffers from mental illness is not a practicing Muslim or he has distanced himself completely from religion. However, the detachment from God, Allah, may increase the likelihood of difficulties that the patients may go ahead and actually experience, such as depression, anxiety, substance abuse, and self-injury or self-killing. Now, this point also goes on and cover almost all religions. We find out that religious people tend to do better, regardless, if they are Muslims or not Muslims. But within the Muslim community, there's more stress on it, on certain aspects, in the sense of if you adhere to the religion, you're not going to be suffering as much, and you should be accepting it, which we'll also talk about it. Now, a person of weak faith, for example, may struggle understanding certain stressful events that are happening in their life. They also may be easily affected by the influence of jinn. Now, what is jinn? Jinn are mentioned in the Quran, and they are created by God. Okay? They are not humans, and they are not the angels. They are created out of fire. Jinn is also where we refer to Satan as part of the jinn clan or the jinn creation. So Muslims believe that there could be some supernatural forces that affect and attribute to their mental illness, and these are whispering. Okay? Whispering is that Muslims do believe that it's a primary way for an evil to influence their effect on humans through whispering, affecting their thoughts and feelings. Example, as Muslims do believe that Satan can whisper to you thoughts and drive you to do things. If it was harming yourself or harming others, or leading into depression because you're not content with life, or anxiety, or things like that. Magic. Now, it could be, it is believed that magic, which could be as spoken words or written words, these can affect the bewitched patient or the person who were intended to. And these can affect the mind, the heart of these people. Individuals, they may start feeling they are isolated. They may start attributing that their depression or their life stress or any of the events that they're experiencing are due to the fact that somebody had casted or spelled a magic or a bad spell upon them. Evil eye, which we call in Arabic hasad, or in English it is called envious. It is truly believed that within the Muslim community, within the Muslim faith, that an evil eye, if you don't say, like if you were to compliment somebody, or even if you don't want to give a compliment, but because you're envying somebody about something, if it is their wealth, if it is their health, whatever it is, okay, an evil eye can go ahead and affect that person because you're looking at him from an envious point of view without remembering that God actually gave this person these things. So it is in a way an evilistic approach of doing things to the other person. Possession, again, it goes back to the idea of believing in jinn, bad spirits possessing a human being and affecting them, affecting their thoughts, affecting the way they behave, affecting their health, regardless if it's mental or non-mental. It's just across the board. And these, clients who presented there may attribute their symptoms into being possessed. Again, this is something that we do see in other religions of being possessed. So, what are some of the purposes of mental health or sickness in general, I should say, beside mental health? How do Muslims perceive being sick, if it's mentally or just regular their health? How do they perceive their sickness? It is a test and trial from God, from Allah. Muslims believe that their life consists of test and tribulation. They are integrated with their good times and enjoyment. Therefore, from each test, they will attain spiritual growth and purification. Also, it is a way to cleanse the sins and increase the rewards, because Muslims do believe that any type of suffering, whether if it is physical, mental, even being pricked by a thorn, any of these painful events will go ahead and cause cleansing of the sins. Any suffering will cause cleansing of the sins and will result in more attaining good deeds, which will benefit us in the hereafter. This is based on hadith, which is the sayings of the Prophet, as well as the Quran mentioning them. Punishment and reminder from God. Those who engage in religious prohibited behaviors may believe that their mental illness is a punishment, or it may serve as a reminder or call for the individual to come back to God, to the straight path. This belief is based on verses from the Quran. Therefore, such a reminder may be viewed as a mercy from Allah, that being sick, being afflicted with an event, if it's depression or anxiety or mental illness, is a way to bring back the patient to the straight path of Allah. Now, keeping in mind that Muslims do believe in the punishment in this life to be less, punishment in this life to be a little bit more harsh than the punishment in the hereafter. So therefore, to perceive the punishment here will be much better than receiving it in the hereafter, because we know in the hereafter the punishment could be extremely severe. Spiritual growth and purification. Life trials and turbulence may be viewed as an enhancing the process of purification by overcoming weakness, augmenting the person's obedience to Allah, to God, and also resulting in a firm belief in the relationship between the patient and God. Quick trip back in history, which is Abyssinia, known in Arabic as Ibn Sina. He was born in 1980 AD and he died in 1037 AD. He was born in Persia, a Muslim country. He said that even it is important to know that supernatural causes can attribute to illnesses, and it is widely acknowledged and considered within the Muslim faith. However, he did reject the notion that mental illness originated only from evil spirits. So he did see that there is an organic component to it that one should look into, just not thinking that these are only attribution from being possessed by the evil eye or the envious or any of the topics that we just mentioned. Therefore, as a Muslim community, we need to recognize that mental illness is a legitimate medical condition, and that is distinct from illnesses of the supernaturals. This way, an individual can acknowledge and accept their mental illness and seek treatment from the community and from the medical community as well. And therefore, by understanding it, they will have less of a stigma and feeling about mental illness, because we all know that the stigma that comes with mental illness, especially in faith-based communities and different cultures, could be extremely harsh and could affect even the way that a patient may perceive that stigma and the way that they're going to go ahead and reach out for treatment or help. For a mental health professional, what does he need to consider? when they're going to go ahead and look at these patients. A, they need to look at the identity of these patients. Where did they come from? Their cultural background. What is their belief? Example of that is that in England, there was a study that was done, and they found out that many of the people, especially the South Asians, believe that epilepsy was caused by possession of evil spirits. In the Muslim countries, they will look at most of the time, they look at most of the mental illnesses, okay, not epilepsy, but most of the mental illnesses as perceived as being possessed by evil spirits. So it is very important to look at the cultural background. Where did these people come from, and what is their current belief? And understand it. Also understand their religion belief, because it will play a role in their therapy as well. Also, when did they come in? Are they first generation in the US? Are they second generation? Because as they've been here longer, they may adopt to the West theory and understand it more and accept it even more. Also, find out what is the patient's own perception of their illness. How do they see it? What do they attribute it to? Which could be a way to reaching out to these patients. In patients that are going to be institutionalized, that are going to be in a mental health ward and psychiatric unit. Now, this by itself has a lot of stigma from different cultures. Also, the patient himself may have a lot of issues with them. But they may need to be in there for their own protection, for the protections of those who are close to them and their loved ones. Now, one needs to accommodate some of these issues, okay? For example, a patient could be depressed, or she could be bipolar. And I'm going to take a female patient at this time as an example, okay? Now, as a Muslim woman, their attire, their scarf, their hijab, okay? Who can walk in on them? We know that these wards are mixed in the terms of the therapists who are going to be providing the therapy. So it is very important that the therapist will go ahead and consider the privacy of these patients. Even in regular hospitals, these patients may have a difficulty putting on the gown, because as we know, medical gowns in the hospitals, they're completely wide open in the back, and you're asked to be disrobed, completely. So these are issues that are very important to be looked at, to also give them the accommodation for their time for prayers. So if there are therapy sessions that are going to be conflicting with their time for prayers, we should accommodate them and look at them as something that need to be addressed and respected for the patient, because it will build that bond. Also, their dietary requirements. Most Muslim patients, I can tell you, is that they will require a dietary requirement that is to be kosher, or what we call in Arabic halal, and that is a proper way of slaughtering it, or otherwise they will not be able to eat meat, okay, unless it's going to be fish or vegetarian. So these are issues that, especially for the institutionalized patients, they need to be looked at, and they need to be addressed in a way of understanding them, which comes back to building a better relationship with the patients. Of course, like anybody else, all the patients, their hygiene is very important. And also if they do fall in the month of Ramadan and their therapy. Now, this could be problematic, because if the patient is really adhering to the religion and wanted to fast, fasting is from sunrise to sunset. During that time, you will not be able to eat or drink. Now, some will go ahead and make an exception and will not fast because they have to take medication. But if they chose not to, then the therapist must go ahead and look at that as an issue on how to approach the therapy for these patients with respect to their religion. In conclusion, in order for a mental health professional to provide the most effective and culturally sensitive interventions, it is essential to be aware of the fundamental aspect of Muslim faith. That being said, evidence have suggested that most mental health practitioners are generally very little, if any, are educated in the basic tenets of Islam and practice in Muslims. Also, the fact that Muslims living in the West do not trust their mental health professionals, because these patients are concerned with the mental health professional as being biased, as being non-respective to their religion, and simply a lot of times they're not aware of the Muslim values that the patient will bring in. Therefore, this will go ahead and affect their therapy in terms of what is their therapy versus how it's going to conflict or accept it from the religion point of view. The patient automatically coming in with that stigma, with that belief, is going to go ahead and, put a gap in understanding and being able to open up to the therapist. Very also important point is that therapists must also be aware that their clients may avoid revealing certain information. And these are information that could be sensitive or tabooed within the Muslim community. For example, if there was any issues of sexual abuse, or issues such as premarital sex, or issues such as substance abuse, these issues a Muslim person may not feel comfortable to open up about it, and it will take a lot of time. This time what we're going to require to build the trust, because these issues are automatically going to conflict with the faith, and also the patient may look at it as, okay, I am Muslim, yet if I bring out these issues, then how is the therapist even going to look at me? So there's a stigma behind it, there's issues behind it that a therapist must be willing to overcome. Also, information such as domestic violence. Now, as a Muslim community, already, post 9/11 suffered a lot of issues and a lot of religiosity, looking at them under the microscope and looking at them in a negative stigma and negative way. Therefore, to bring in, for example, the issues of domestic violence within the community or something like that, then they're going to be talking back in a negative way about their own community. So therefore, a Muslim patient may not go ahead and indulge such information. Again, we need to build, as healthcare practitioners, we need to build that trust between us and the Muslim patient. Let them know it is okay to open up. Let them know that you are aware of their culture and also of their sensitivity to many different issues. Respect it. These ways can only be done through understanding and having some basic knowledge about the faith itself and the practice with respect to where Muslim people came in terms of their background, whether if they're African Americans, whether they are European Muslims, whether they're from the Middle East, whether they're from Persia, or whether they are from East Asia, or whether they're just Asians. It is very important to go ahead and focus on these points. And with that, I will go ahead and invite my colleague, Dr. Faisal Qazi, to go ahead and continue this talk and cover some of the important things that he would like to go ahead and address. Thank you.
Well, thank you so much. Again, Faisal Qazi is my name. I do three things, and thank you for a long introduction. Not really deserving because I'm doing just three things. One is I'm a professor of bioethics at the new Muslim college, Bayan College in Claremont. So I have an interest in cultural and ethical issues and do some research in that arena. I do serve with Dr. Kaissi and we co-founded Minds, medical network devoted to service. Part of what we do is charitable healthcare work. And as an executive board member of California Neurological Society, which is my professional society, I do health policy work. So today's discussion, of course, is revolving around mental illness and Muslim health. Dr. Kaissi mentioned Ramadan, month of fasting. If you don't know, when I was young, when I was probably about 7 or 8, that was the last time we got to fast in the summer, because every 10 years, 20 years, it comes around in the peak summertime. So, but then I didn't have to fast. Now we're going to have 16, 18-hour fasts. So it's going to be a long day. So only God accepted a doctor's prescription and know, some of my patients would have appreciated it. So well, that's a different discussion. So I'm going to start out with a case. Are there psychologists in the room, counselors, therapists? So a number of you. Do you do mostly in religious setting, or do you do in a professional setting, school-based setting?
Forensic.
Forensic? Oh, wow. Okay. Is anybody in a church setting? Church? Okay, wonderful. So here's a case of a patient who's in his mid-40s, ethnic background is Somalian. He came to me after having gone through counseling, even by religious experts who had content expertise in psychology or trained in psychology. His symptoms were chronic. They were perpetual, going on for quite some time. The symptoms included a lot of paranoia, delusional thinking, anxiety, and he would, for example, tell me that his aunt, who was housing him, that his aunt is conspiring against him. And this is not unusual. We've all heard those. So, but he was very distraught, and he couldn't trust anybody. And so he was hopping from place to place, looking for a place to live. So I was referred to him by a religious counselor, as a counselor in a religious setting, but a trained counselor. And he, all along, as I was treating him, he had refused medication treatments. The only thing he would tell me is that he trusts reading the Quran, which is the holy book of Muslims. That's all he treated. That's what consoled him, comforted him, and that's all he would do. He would not take any medications for me, which I really thought he needed some. And I really was increasingly concerned about him because I just think his symptoms weren't dissipating, they weren't under control. But he was stable, essentially. The paranoia wouldn't go away. He had really difficult time trusting his own family. And then he started traveling because he wanted to get away from everything. And he went to places like, he went to Somalia. He wanted to go to Yemen. Now, those two countries, if I mentioned, when I heard that, first thing that came to mind is this is a national security disaster. Because, and if you know anything about the Muslim community, the issue is, we're dealing with a particular law enforcement problem. It's called entrapment as a civil rights issue. In which case, in order to prevent a problem from occurring, law enforcement, particularly FBI, often seeks out individuals that are a threat. But in reading a number of those cases, what we're beginning to realize is that half, if not a majority of them, are individuals with what sounds like mental illness, underlying mental illness of some sort. This guy would be a perfect example of a guy who travels to a country that's listed, or blacklisted, and then getting in trouble as such. So the minute I heard his last visit 6 months ago, I called his religious counselor. I said, this to me sounds like a bigger problem, but he still would refuse treatment, and his comfort was only in religious motor treatment, which helped to stabilize him. So keep that in mind as we discuss these peculiar cases, and keep in mind as folks involved in and around LA County on issues of mental illness and religiosity, what we can do to comfort or treat and really protect these individuals. The philosophical underpinning of treatment or self-treatment, because remember, religious treatment is self-treatment, essentially. This is by individuals who really do it to comfort their own sake, for their own sake. The underpinning in the Muslim context is the idea of remembrance. Remembrance is the Arabic word zikr, which really means remembering God consistently, frequently, and that's just part of the Muslim prayers, 5-day prayers. But people do additional elective aspects of religious services, and just as sitting down and remembering the name of God or reading the Quran itself, the holy book, or other religious traditional work. In the Quran, two particular verses that stand out to me are very profound, that highlight the importance of this. So one is, only in the remembrance of Allah, God, will your heart find peace. So this is a divine injunction. And then their skins and their hearts or heart will soften to the remembrance of God. So that is a prescription to Muslims in general, to believers, to faith adherents of the faith, to engage in the remembrance of God as a spiritual tool. How would a Muslim remember God? Well, Muslims remember God through a mechanism of prayers. Dua means actual prayer, supplication, but there are also prayers which is salat, that is the actual physical component of 5 daily prayers. So there are two forms where Muslims actually engage in dua. Dua itself is a form of zikr, which is remembrance. Now this is a very traditional but historical picture. I can assure you Muslims don't dress like this anymore. Well, no, we have folks who have turbans, but this captures this picture. It stands out to me because just the aura, the background in it is highly spiritual in nature, captured by a French painter. So it's something to keep in mind about the importance of prayer and congregational prayer. A scholar used to say that because you have congregational prayers which are fairly well emphasized. So there's sort of solitude and multitude and solitude, essentially, when you're looking for that isolation and connecting with God. So let me see. I have a video. I just want everybody to see if you can observe this. And I don't know if my video will play here. It's an MP4. If not, I do have it. But it's a 2-minute video. Taif, maybe it won't play on your computer. Something's wrong with yours, not my Mac. But I think I have a direct video of it. So let's just observe it for 2 minutes. And I don't know how much audio we have here. And then I'd just like to bounce back some ideas, your thoughts, and what your observations would be. You can actually pause it till you get the audio. So just as in context, this is a prayer from Mecca, one of the holy mosques, where the house of God is situated. Muslims frequently visit as an obligation called Hajj, or as an elective called Umrah. So you'll see a lot of people, visiting the Kaaba, the holy center of the mosque. And these are Ramadan prayers. Ramadan has specific, extra prayers, extra elective prayers at night. It draws large crowds, millions. And so watch this and tell me what you think. So we're open to discussion. What are some perceptions just watching it before I go into my description of it? Any thoughts? Anything stands out for anybody? Yes, sir. Go ahead.
Same prayers that everybody prays.
Same prayers that everybody prays. Excellent. Now, aside from the video quality of YouTube, or aside from the Arabic language that nobody probably understood here, with at least this video provided some translation. What else? Yes, ma'am.
They are all sharing in the same general feeling.
Congregation, yes.
The congregation, yeah.
Okay. Any other perceptions? Yes, ma'am.
One part of the prayers is asking God for grace in all our states.
Right.
Which I think speaks to the mental health issue.
Sure. That's a brilliant point. Thank you for that. Great. Yeah, one thing I noticed that, 1 minute into it, the imam who was leading the prayer got really emotional. And people behind him were just profusely crying. So that was, and that's very, not typical, but it's very commonly seen during Ramadan, because it's a month of fasting is one of the highest heightened spiritual months for Muslim observance. So that was very interesting, and then just the format of the prayers with your raising your hands up as if you're, because in Islam you'll see in traditional terminology for observant Muslims, often the Quran uses the word servants. This is, or somebody who has to beg, because you beg for mercy. So the relationship between God and man is, when Dr. Taif says submission, is really submission of your will. Not so much, I would take that back. It's submission of your attitude to God. So your attitude is one of humility. You don't come in the presence of God with arrogance. You come asking. So that's a very important component of Islamic spirituality, actually. Now, you all, I don't know if you've heard of some of these names, Pamela Geller and others that are quite harsh critics of Islam. We have a new name for them. Anybody knows what that name is? Islamophobes. So Pamela Geller, for example, has started talking about, these are the people who submit. She couldn't find anything else, so she wanted to sensationalize the word submit. And Muslims use it very commonly, very frequently. So the issue is that you have to submit as in her point was that Islam is a religion of oppression. So therefore they submit because everything has to be submitted to. Yet the meaning, context of it in practice is quite different. It's really submitting of your attitude and your behavior to a higher being. And this is a direct connection. So if you're I noticed that maybe there were some theologians in the audience. You may draw some parallels, but you can also see some differences in Christian spirituality, where in Islam you have God has divine attributes, and mostly is recognized through exactly divine attributes. In Christianity, there's a human connection. In other words, there's human attributes, going through identifying God through Holy Spirit, and that is Jesus Christ. So there's some interesting differences. Yet I think the culmination of the end sum of it ends up being the same. It's a very high level of spirituality, internal connection with God. So given that model of spirituality, understanding that this is what a Muslim, observant Muslim, is trying to reach to that state of a connection with God, let's look at what Quran describes into what is operationalizing that. What's operationalizing that is a Quranic model of ego. The word uses nafs. Nafs essentially, in general terms, meaning your base self, inner self. Now, Freud had a model. Psychologists here may know Freud's model of ego is id, superego. If you know that, if you understand that, try and see parallels with this model, if you will. In the Quran, Quran describes nafs al-amara, which is a soul that commands. You can think of it as Freud's base ego, just ego itself, or id actually. Id would be a better parallel to that. So this is the base inner self. This is a self that has no control. It's impulsive. It's irrational. It's animalistic. It's got base desires. It needs to act upon those base desires. So the objective of the spiritual regiment is to really exert some control over this particular aspect of the base of the soul. So that's nafs al-amara. The second one is nafs al-lawama, or soul that blames. This would be the rational thinking. So every time the base ego, nafs al-amara, wants to do something, nafs al-lawama, the soul that thinks that actually blames the base self, saying, well, let's think about before I do this. What are the consequences of this? So the idea of ego itself. The only thing is that Freud's ego model was animalistic. This is more rationalistic. And the third level is nafs al-mutmainna. This is where the soul is trying to reach. This is the highest point. This is the end outcome. And what that means is soul at peace, a satisfied soul, a completely content soul, content from within, content from without. That's the Quranic model, and that's the ultimate goal. So the Islamic psychology thus becomes necessarily a tool, a science of nafs, psyche. And these are the steps that are followed. Dr. Taif mentioned some of the early works done in 10th, 11th, even as early as 8th century by Avicenna and others. That's how they actually revolved a lot of their models around, treatment models, in achieving these steps, in going through these particular steps. So I take, for example, in all the number of mental illnesses, take, for example, anxiety. So there's one from Al-Andalus, a Spaniard Muslim, very famous, Ibn Hazm, great scholar. Most of his work was known for education. In reviewing his work, for me, I found his commentary on psychology much more interesting. Maybe because that's my field, I do neurology. But this was very interesting because to him, the base state of a human being is one of anxiety. So everybody gets that? The base state of all of us is anxiety. And the function is that the challenge of our environment and our spirituality is to calm that base sense of anxiety. So for example, he says, anxiety is everything that occupies a human being's mind as a result of desire, such as anxiety of poverty, sickness, being undistinguished, missing pleasures, or ignorance. And really, so for example, he says, the anxiety of the desire to seek knowledge creates the anxiety to go about the procedure of seeking knowledge, going to school, paying for tuition. That will make anybody very anxious these days, Anxiety to, I guess, achieve some sort of notoriety or fame puts that pressure, or the desire to do that puts that pressure on one to act upon doing a number of things that, according to him, may be more base ego or base self, impulsive. They're not the righteous way of doing things for him. And so on and so forth. So desire to obtain wealth, according to him, creates the anxiety to go about the procedure of obtaining wealth. So how do you get rid of these anxiety? Because that's a base state. He suggests that the only way to rid of that underlying baseline anxiety is to do good deeds, righteous deeds, because that would expiate, that would calm down and settle down this degree of anxiousness. So that's his formula. So the early Muslims who developed the science of psychology really focus on and working in terms of heightened sense of spirituality. Now, has anybody seen this movie, Good Will Hunting? Yeah, great movie, right? So, I think psychologists may take particular interest, therapists must take particular interest in it. But if you haven't seen it in a while, review it. Because actually, when, the story is simple. Well, it's not simple. It's an extraordinary story of a young man who was hanging around doing janitorial work at Ivy League College when he was discovered by a famous mathematician, a genius professor, because he was just a kid genius who solved all the most extremely difficult equations that no one else could solve. He just had it in him. That's kind of based on a reality, because there is a real individual in India, actually, 100 years ago or so. But if you look at how that particular kid genius, he had a lot of issues. He had closure issues. He was abused as a child. And the psychologist that was assigned to deal with him, Robin Williams in this case, really the procedures he took, the therapy he did was extraordinarily unconventional. He actually had to confront him in order to open up. He had to actually take him to dangerous levels of confrontation to open up about abuse and come to acknowledge it. And only then that kid's mind settled down and he took his talent seriously. Otherwise, he was reckless, throwing away his life. Some of those same concepts, actually, confrontational models, were used by some of these early psychologists in the Muslim psychological fields to come up with treatment ideas that will reach to the heightened content state of the nafs. So they had to basically work in very creative techniques to do that. So as a neurologist, I'm following a lot of new developments in the field of spirituality, and we have mapped neural circuitry. And these are just names, I'm not going to go over too much into it, but these are some certain areas of the brain that are actively involved. And we know this because they've done PET scan functional imaging, where you can see these areas light up when somebody is sent through a regimen of spiritual exercises. If you, I don't know if you watched this NPR or heard this NPR segment on spirituality, because this was done recently. They covered some of this stuff, and one of the titles of the program was "The God Chemical." Anybody remembers that? Well, if you're really curious about it, serotonin is the God chemical. That's your spiritual chemical. Dopamine, by the way, is a chemical in addiction. It recreates pleasure. It makes your circuitry, neural circuitry, akin to or sensitized to pleasurable activities, gambling, for example. So there's some medications for Parkinson's that increase dopamine levels, and now there's a black label warning on them that you can get involved in impulsive gambling, and we've seen some bad stuff with that. But so dopamine plays a role in sort of in working in this neural circuitry, so establishing the enjoyment that comes with spiritual exercise. There's also so this is the God chemical, and there's now a moral molecule, if anybody's interested. It's called oxytocin. So we're getting very creative in science, in the spirituality field. So what exactly happens physiologically? Research has definitively proven that cortisol levels go down. Cortisol is a stress hormone, by the way. I mean, not all stress is bad, right? Some stress is a positive motivator, but most of the stress we have in this country is bad. We all know that. I just went through 2 hours of traffic. That was pretty bad, So that's LA traffic. But what they have done is they have done research with people reading the Quran, for example, and they would check their blood pressures. They really noticed that blood pressure levels declining significantly. And while they're reading it in that state of mind, they remained low. And by the way, these days, in case you haven't heard, the lower these days, the better. Doctor's advice, keep it low. There's other, the inflammatory content, it's called interleukin, inflammatory chemicals in the body go down, and then your immune system actually increases through these spiritual exercises. These are proven. One study, they've done studies, as to people are healthier, have less heart attacks, less rates of cardiothoracic surgery or heart surgeries if they go through routine prayer formats at a church, for example. That's been proven. But they did another very interesting study, which was the indirect study. They took a group of people who, they took two groups of people, and for one group, they asked a group of indirect individuals to pray for them. Just go someplace and pray for them and pray for them by name. And this is a general trial research. This wasn't involved. This didn't involve just Muslims. This was a large-scale trial. Some of you may be aware of it. And they noticed that the people who were prayed for actually had less rates of illness in general, physiologic general illness. So it's something very interesting. So I'm I don't want to. It says the girly channel. That wasn't my intent, but it just tells you that if you want to reduce your cortisol, maybe do get off politics. But no, you can watch whatever you want to watch as an alternative, except for maybe Fox. Sorry, I had to say that.
Thank you.
It's LA, you can say that in LA, right? So I wouldn't be able to say that in Michigan, I think. I trained in Michigan, so they watch the hunting channel there.
Yes.
Another case, I had a female patient in the mid-50s, a Muslim patient, who was in a very strained relationship. She, for several years, more than 4 or 5 years, she would sit down with her husband and family, and there would be no conversation. Now you can imagine how torn of an environment that is, especially for children around, because they take a lot of stress from that. So there's a lot of tension at home. By the way, tension at home conflicts, they don't necessarily result in issues like depression per se, right? I mean, depression has a genetic aspect to it. But they could be contributing factors. They could be stimuli, external stimuli that could exacerbate one's underlying depression. I think psychologists here realize that. So this is somebody who came and we had a very long conversation. And if you and I are treating a patient like that, and from the medical point of view specifically, what does our training say? Well, our training dictates that if you have an external stimulus that's precipitating an underlying depression, you have to remove that stimulus. What else can you do? I mean, you can try medications, but generally, unless you remove the stimulus, medications even are not that effective. So the question is, do you propose her to consider divorce, which is somewhat of a taboo issue in religious communities, period, not just Muslim? Or what do you do? So so religious counselors may approach it very differently than a medical counselor. And this creates, because what we can do is we can create real big social problems, or we have to address social problems. But we have to often wonder that as we counsel people, are we contributing to social crises, or are we actually resolving social crises? And this was one of those cases for me where this was a very tricky issue. I mean, she came to me as a medical professional, not somebody who's a bioethicist or who has some knowledge of Islamic disciplines. But something to keep in mind. Now, so what is the treatment? I mean, what are the treatment approaches? Do we have everybody start praying constantly? I mean, Spider-Man, you can give, if Tobey Maguire was Muslim, maybe he would be praying like this. So, I mean, pray all day. I mean, sure, prayer is a huge component. And that has to be part of the treatment modality for religiously observant folks, particularly Muslims, because we know that it works. We know that it has a stabilizing effect. I can tell you as a scientist, as a clinician, I don't think it's, look, I'm trained here. Well, I'm actually trained in Michigan. But, the science is very rationalistic. Science tends not to be spiritualistic, it's rationalistic. So a good portion of our training is always looking to justify what spirituality means, not necessarily adopt it as a treatment option. But I can tell you that, prayer alone perhaps will not really solve their entire mental illness. I think ultimately you need a multimodality approach, which may necessarily include medications. So we have to be aware of that. And there's a lot of people these days who refuse to take medications or not too keen on taking medications. So we have alternative ways, behavioral adaptational therapies, other therapies. But this is something to keep in mind. So here's where neurologists leave it off to the therapist, because this hadith, which is a saying of the Prophet, said the essence of the religion of Islam is offering good counsel to others. So making counseling a very important component. Well, where I think the non-pharmacological treatments for me take a significant role in really achieving the final outcome, which is, I think, the content, satisfied spiritual soul. The religious rituals are an important component of therapy. I'll give you an example. We had a young gal who was about 16, 17, was very distraught at home and just wanted to leave. And, her parents were not intense disciplinarians. They weren't like the helicopter parents. Helicopter parenting, they're just on your head all the time. They weren't like that necessarily. They were fairly open in terms of giving her choices of what she wanted to do. But she would go to therapy, and then she would talk about how her parents are religious, they're Muslims, and she just wasn't sure what she was. And the therapist's counsel was to leave the religion, perhaps, because that was the problem. That's what we would do, So when you're 16, 17, and you're getting disciplined, or you have some stipulations on you, no 16, 17 wants stipulations. I know I couldn't even stay out till 10 p.m. That was just wrong. So I could have been out there complaining to somebody about that. So for a lot of Muslim kids, if you're counseling Muslim kids, know that if they're blaming religion onto something, quite often it could be just simple disciplinary issues at home, but they are put in the context of religion. They may say, well, it's not a good thing for you to stay out after evening prayers, just as a marker of timing. So, to convert that into a philosophy of oppressive religion would be misconstrued. And that's what we need to actually get to that level where we can provide therapy to accommodate religious content on patients' background. I think medications do have a role to play. So what are the future challenges? I think two future challenges vis-a-vis Muslim community are very important for LA County Department of Mental Health to consider. One is, Dr. Taif already alluded to that. We have young men and women and older, they're very vulnerable. They're very vulnerable and they could get themselves in trouble. This is where the law enforcement strategies come in. I think from what we're saying, the law enforcement, national security apparatus does not want to or does not for some reason take into account mental illness as an underlying factor for a lot of them. Now, you can say, well, a mass murder is nuts. Sorry, I mean, they're recording, but you can say that. I mean, so in other words, any act of extremism is necessarily could be proven to be related to a mental illness. But in some of these cases that we're seeing, there's clear-cut vulnerability, people that have delusions and paranoia. I mean, really, really simple stuff. So they need early intervention. They need early help, not law enforcement kind of help. So that's something we must realize and find ways to work. And I think that's something we're definitely proposing time and again. Second issue is county is considering countywide initiatives in different religious settings, which I think is a great idea. and providing training and services to first responders, those who would come across a mentally ill patient, so they know where to send them professionally. Professional help could be sought. So I think that would be an incredible program. I'm just going to leave it right there, and would love to take comments. I think for both of us, would love to take comments and your thoughts on the issues involved. Thank you so much.